Quick question. Imagine a patient walks to the ER complaining of chest pain. They say it feels like pressure, like something heavy is sitting on their chest. Do you think all chest pain always means a heart attack? Well, today you might be surprised because not all chest pain is the same, and missing the difference can cost a life. And to our main topic for today, angina. Angina is chest pain resulting from myocardial ischemia caused by inadequate myocardial blood flow and oxygen supply. And to the pathophysiology. Angina is a type of coronary artery disease. Coronary artery disease is narrowing or obstruction of one or more coronary arteries as a result of atherosclerosis, which we discussed in our previous video. Atherosclerosis is going to cause accumulation of lipid-containing plaque in the arteries. The coronary artery supplies the heart with blood, so anytime there is accumulation of plaque or plaque buildup within these arteries, it is going to result in inadequate myocardial perfusion and oxygen, leading to a myocardial infarction, angina, or heart failure. So angina is just one of coronary artery diseases. And to our causes, obstruction of the coronary blood flow resulting from atherosclerosis is one of them. Coronary artery spasm or conditions increasing myocardial oxygen consumption are all factors that can result in angina. And now to the patterns or types of angina. Angina can be stable, unstable, or the variant angina. So for stable angina, it is chest pain that occurs with exercises or an activity, and it is relieved with rest or nitroglycerin, and it lasts less than 3 to 5 minutes. And for unstable angina occurs with exercises or with rest. The pain increases with duration, frequency, severity with time, and lasts more than 10 minutes. And for variant angina or the Prince metal angina, it's caused as a result of spasms with the coronary artery. And for your NCLEX exam, do not confuse yourself with angina and myocardial infarction. So differentiating angina from myocardial infarction. If the pain lasts more than 30 minutes, then we are sure it is not an angina, but rather a myocardial infarction. So if it is lasting more than 30 minutes and the pain is not relieved with rest or nitroglycerin, then we can conclude that it is a myocardial infarction and not angina. And now for the risk factors. Old age is one of them. Family history, hypertension, obesity, diabetes mellitus are all risk factors to getting angina. And now for the diagnosis. So for our diagnosis, ECG is normal during rest with ST depression or a T-wave invasion during pain episodes. Stress tests can also be done. So stress tests can result in chest pain or changes in our EKG, which may indicate an ischemia. Take note that in angina, the troponin levels are normal. And for cardiac catheterization is one of the diagnostic tools that can be done. So when we do a cardiac catheterization, it is going to provide an information about the patency of the coronary arteries. And take note, this is one of the definitive diagnoses used for angina. And now talking about the signs and symptoms, take note of the characteristic of the pain for your NCLEX exam. So the pain is usually described as mild to moderate and substernal, crushing, squeezing pain, and may radiate to shoulders, arms, jaw, or back. Aside the pain, they can also have dyspnea, which is difficulty in breathing, pallor, sweating, palpitations, dizziness, or an increase in their blood pressure. And to our management, the main goal of treating an angina is to provide relief from the acute attack, correct the imbalances between myocardial oxygen supply and demand, and prevent the progression of the disease and further attacks, and reduce MI risk. This goal is very important for you to note for your NCLEX exams. So for the medical management, we are going to give the patient a sublingual nitroglycerin, and take note for your NCLEX exam that the administration of this drug is very key. Now the patient can take up to 3 tablets. So anytime they are having their attack, the first thing is to take a rest and then take 1 tablet and put under the tongue. If the pain is unrelieved after 5 minutes of placing the drug under the tongue, they should call 911, but then they can go ahead and take the second dose. They should then wait for 5 minutes after taking the second dose and then take the third dose afterwards. Aside nitroglycerin, other antihypertensives such as beta blockers can also be administered. Cholesterol-lowering drugs such as statins can also be administered. And now to our nursing management. We are first going to assess the pain, especially the characteristic of the pain. Then we administer oxygen. We assess their vital signs. Then we are going to obtain a 12-lead ECG. Take note, for your NCLEX exam, any condition relating to the heart, we have to obtain a 12-lead ECG. And then after acute episodes, we are going to assist the patient to identify angina precipitating events. We are also going to educate the patient to consume a healthy diet. They should lose weight if they are obese. They should reduce stress, and they should also avoid the use of tobacco if applicable.